You prescribe a deep restorative treatment to rebuild a patient's constitution, but instead of improving, their acute symptoms immediately flare up and worsen. This treatment fails because the practitioner attempted to treat the root deficiency before resolving the active, chaotic excess. Classical medical texts recognize this danger implicitly. They understood that disease is a loss of order within a living system, and that treating it requires moving in strict sequential stages. Modern chronic disease management frequently skips this sequential staging. Practitioners try to bypass containment and jump straight to repair, ensuring the treatment fails. Preventing these errors requires returning to an unbreakable operational law of living systems. We must follow a three-phase clinical triage checklist: control, stabilize, and restore. Step 1. Control. This means restraining active pathological forces, like acute pain, infections, or bleeding. These actions are purely defensive. We must drain excess, clear heat, and close biological gates to prevent escalation. Control is strictly an act of firefighting. It does not rebuild tissue. It does not nourish the body, nor heal the root cause. Its sole purpose is to stop the damage. This creates the nourishment trap. Attempting constitutional repair during uncontrolled excess is like hammering new shingles onto an actively burning house. We know this phase is successful only when the disease escalation has definitively stopped. The patient may be entirely exhausted, but the acute threat is contained. Phase 1 preserves life and prevents systemic destruction. With the fire out, we move to the yellow section, stabilize. The objective shifts to re-establishing functional order. We take a chaotic system and level it out, settling patient agitation, normalizing breathing, and anchoring erratic vitals. Stabilization does not mean absolute stillness. It means achieving a state of evenness and dynamic balance so the biological systems can coordinate again. Clinicians often make an impatience error right here. They see the emergency is over and rush straight from containment to deep healing, skipping the stabilization step. If you skip stabilization, your restorative treatments won't take hold, nourishment will fail to settle, and your remedies will only further agitate the patient. Phase 2 is the essential bridge. It makes the system structurally sound to accept long-term care. Now that the red and yellow phases are entirely resolved, we unlock the final section of the checklist, restore. This is where we execute long-term constitutional treatments. We nourish yin and blood, replenish jing, and correct long-term elemental imbalances. Unlike the initial emergency response, restoration is a slow process of cultivation. It is not an urgent rescue mission. Deep restorative work requires time, and it relies entirely on the highly predictable internal physiological conditions we secured in the previous steps. The success metric for this final phase is the patient exhibiting a gradual, sustained improvement in their baseline resilience, completely free of acute flare-ups. Attempting constitutional repair without a controlled and stable foundation isn't deep medicine, it is wishful intervention. This completed checklist gives you a foolproof, sequential guide for all future patient assessments. Control preserves life, stability enables function, restoration builds resilience. Rigidly following this hierarchy protects your clinical practice from misuse, adverse reactions, and systemic treatment failures. Download the blank clinical triage checklist below and use it to gatekeep your patient's state before writing your next long-term prescription.